SI Medical College and PGI MSR, Bengaluru. His areas of interest include TB, HIV, diabetes, tobacco, and hypertension. So his major achievements include he has worked as a national consultant in TB for more than 8 years. He's been trained in operational research by the Union at Paris, France. He's contributed immensely to research. He has more than 170 scientific publications in eminent index journals. He's been the chair for NTEP Zonal Task Force Operational Research South Zone 1 for quite some time. He's received many awards and honors as well. He's been awarded by Karnataka Association of Community Health with the Commendable Researcher Award in Community Health. He has delivered orations and guest lectures at various platforms. He has taken the lead as far as operational research is concerned, and he's been actively involved in the National NTEP IAPSM Sub-National TB Certification Task Force as the lead. So we are indeed blessed to have you with us, sir. So our next chairperson is Dr. Akshay. So I've been blessed to have him as my senior colleague here. So Dr. Akshay KM is an additional professor in the Department of Community Medicine, Yenepoya Medical College, Mangalore. His areas of interest include tuberculosis, tobacco, maternal and child health, medical education, and operational research. His major achievements include he's been actively involved in research. He's been the PI and co-PI in 11 intramural as well as extramural funded projects. He has been the mentor for operational research courses at national and state level. He has published more than 30 papers in national and international journals. He has received numerous awards. He's been the member of the State Operation Research Committee, NTEP Karnataka, and he's been awarded with travel grants by the Union and National Academy of Medical Sciences. We welcome you, sir. So I request the chairpersons to kindly take over this session. Thank you.
Thank you, Dr. Prashit. Good morning, everyone. It's indeed a pleasure to introduce our speaker for this particular session, Dr. Shazia Anjum. She is MBBS, DNB, MPH. She is affiliated with World Health Organization and working as medical consultant for NTEP program and at Bangalore, Karnataka State Headquarters consultant. Her areas of interest are tuberculosis, epidemiology, and communicable diseases. She is a diplomat of National Board for Community Medicine from New Delhi. Some of the awards and honors: she is a gold medalist in community medicine and OBG and a gold medalist in the field of epidemiology from GGSI University, Delhi. We request the speaker now to deliver her session.
Should I stand on this?
You can stand however you're comfortable. Yes.
Namaskara, Mangaluru. A very warm and pleasant feeling today in Mangalore with due authorities, administrative and technical authorities of Yenepoya Medical College, all the delegates who are present here, especially the who's who of public health in this hall. And while I speak about TB, I also identify all my gurus here, the stalwarts of TB, the lions and lionesses of TB, Dr. Ravindra Reddy, Dr. Sharath, Dr. Sangeeta. So I think absolute credits to all of them for bringing the program to what it is today. So without much ado, Thanks to Dr. Akshay and Dr. Poonam for inviting me to this session. I'll take you through the tuberculosis elimination strategies, challenges, and the roadmap in the current scenario with WHO's perspective. This slide actually talks to you about Mycobacterium TB, the causative agent of tuberculosis, which was discovered in the year 1882, 24th March by Sir Robert Koch. It's been almost 139 years, but then we are not able to have any vengeance on this disease or a hold on this disease even to this day. This is what is the spectrum of tuberculosis. So only when you understand this epidemiology, you will be able to understand the challenges we are facing today. So if you look at this, whenever the bacilli enters a human being, there are two scenarios. One, it will be just kicked out of the body by the innate immunity or by the acquired immunity. The second scenario is where the bacilli is going to lodge in our bodies, and that is known as latent TB infection. And that is a phase of dormancy where there would not be any active signs and symptoms. A very new phase called subclinical disease has come up of late, where the bacilli is lodged in the body, but also tries to throw signs and symptoms very subtly. So this is a phase which is known as asymptomatic TB. And the last one, of course, is the full-blown active TB. Right, now let us look at what is TB disease. It's changing here, but not there. It's changing here, but not there. Yeah.
Doesn't matter. It's changing here.
Yeah, fine. So we all know the signs and symptoms of tuberculosis, most importantly, cough of more than 2 weeks, fever, weight loss, night sweats, chills. So you also know that an active TB patient, if at all he or she is left untreated, will be able to pass on the infection to 10 to 15 people in a year. Most importantly, we also need to look at the TB burden, both globally and in the Indian context. India contributes to 26% of the global TB burden. Similarly, India also contributes to 37% of the TB mortality. However, India has also committed through our Honorable Prime Minister that we would be ending TB by 2025, 5 years ahead of the global TB target. Now, what are those sustainable developmental goals which we are all looking into? The major goal is to end AIDS, TB, malaria, and other neglected tropical diseases and communicable diseases, under which the WHO End TB strategy has clearly laid down the protocol of reducing the TB incidence by 80% of what it was there in 2015, by reducing the TB mortality to 90% of what was there as a baseline in 2015, and also to ensure that no affected household is burdened with the catastrophic expenditures of managing TB. As I've already told you, India is actually in this phase of ending TB by 2025, so 5 years ahead of the SDG targets. We should also understand that TB is the #1 infectious killer disease just after COVID. But all in all, you should also thoroughly understand that among the top 10 causes of death or the top causes of death, TB stands at the 13th position. We are well aware of this fact that it is not just TB. TB is a socially vulnerable and economically vulnerable disease also. So the biggest factor is the malnutrition or the undernutrition. And then there are attributable factors of smoking, alcohol usage, diabetes, and HIV. Funding is another important game changer. So if you look at this, US $13 billion was what we were expecting for the programs, but what was offered was only 5.3 billion. Similarly, even with regard to research, at least $2 billion were expected to be spent on research, but hardly 901 million is what is being spent. We all need to also understand a thorough definition of what is the difference between the erstwhile RNTCP, Revised National TB Control Program, and why did we rename it as National TB Elimination Program. There is a difference of thought that control is just, minimizing or confining it as a controlled disease so that it is not a public health problem. But when it comes to elimination, we are actually thinking of cutting down the transmission dynamics of tuberculosis. This gives you a clear picture of what is TB elimination. In true sense, TB elimination is less than 1 case per 10 million. Here it is million, so all forms of TB per million population or per 10 lakh population. So for every 10 lakh population, we would expect less than 1 case. What is the current number of cases? At least in our country, we have 188 TB patients per lakh population per year. Imagine translating this to less than 1 case per million or less than 1 case per 10 lakh. There have been a lot of strategies to eliminate TB. The first of its kind is the National Strategic Plan of 2017 to 2025. And the second one is something which Karnataka prepared on its own. Of course, with due acknowledgements to the state nodal officers and the state officers and the administrative officers and the WHO colleagues, of course with the contribution from medical colleges, the strategic plan was released by our Honorable Health and Family Welfare Minister in 21. And our MD&HM ma'am also presented this strategy, including elimination of TB at Gram Panchayat level at Vigyan Bhavan in the last World TB Day. What are we eyeing at? We are eyeing at a subnational certification where our districts are, branded against certain awards. So last year, Karnataka applied for all the 31 districts of subnational certification. 9 of the districts won bronze medal, meaning that we could reduce the incidence by 20% of what it was there in 2015, and 5 of them won silver medals, meaning they could reduce their incidence by 40% of what it was there in 2015. We all know TB spreads through air. It's an airborne infection disease or the communicable disease. We also know the dynamics of the droplet transmission. But what is important is how do we prevent this transmission? So it is not just personal protective measures, but it needs a lot of congregated efforts from the environmental and administrative measures. The most important one is this, where we have underlined a statement that whenever we have the following symptoms, then we term that person as a presumptive TB. But the underlined statement says that any person with an abnormal chest radiograph should also warrant you that you should search for TB disease. So this is what I was referring to as asymptomatic TB. So in the recently concluded National TB Prevalence Survey, almost half the people who were diagnosed with TB did not have symptoms, but they had a classic sign on the X-ray. The diagnostic modalities are still the same. We are still relying on sputum as the most important specimen for diagnosing TB. We are also relying a lot on the conventional microscope. So today is an era of molecular technologies. We should all move forward and see to it that we offer upfront molecular technologies and do away with the age-old smear procedure. I don't say that we have to completely stop this. At least this could be used as a follow-up technology, but not as a diagnostic technology given the sensitivity of the tool. Karnataka also has state-of-the-art culture and drug susceptibility testing laboratories, one in IRL Bangalore, one in KIMS Hubli, and one in RIMS Raichur. However, we will also need to step further and look at upgradation of molecular technologies, especially in terms of CB-NATs and TrueNATs. And especially given the fact that these NAT machines are capable of, detecting resistance to an array of 13 drugs today. So we need to all jump into those 10 colored machines and also look at point-of-care technologies for TB. The biggest change we have had in recent days is movement from intermittent regimen to daily regimen to treat TB. But that is not enough. We also have weight band-wise drugs. Now the challenge is to further reduce the duration of treatment. There have been a lot of clinical trials where we are reducing the drug-sensitive treatment from 6 months to 4 months by adding newer drugs. We all know TB is an age-old menace. If these are the conditions, you can expect the transmission dynamics. Imagine, this could have been like a red carpet for TB transmission. And the most vulnerable are these kids. Primary transmission is at the highest today in the country. With all this came up the most important year, which is 2022, where we had the highest political commitment by our honorable President, Srimati Murmu ji, who actually gave a challenge to the country that we will be able to eliminate TB by 2025 through something known as Pradhan Mantri TB Mukt Bharat Abhiyan. She launched this campaign on 9 September 2022. Simple thing like providing nutrition to the TB patient and his family will do a long way. Also, this is an opportunity for all of us to explore Nikshay 2, where we are leveraging on the CSR. Any of us can become a Nikshay Mitra. So all of us sitting here can adopt one TB patient. This is what you will all have to do. Even on our birthday, we spend at least 1,000 to 1,500 bucks on one cake. You know, that can become the ration for the entire family for 1 month. So that is what is required to support TB patients. This was our meeting with the governor of Karnataka just 2 months back, and our honorable governor was very much happy to actually adopt TB patients and also invite corporates so that they deliver their corporate social responsibility. We all also acknowledge the fact that the soul of India lives in its villages through Mahatma Gandhi ji. So there is an urgent and dire need of involving the Gram Panchayat members to eliminate tuberculosis. There were joint circulars between both the Principal Secretary of Health and Family Welfare Line Department and the Principal Secretary of RDPR Department so that they work in close collaboration. This is one Herculean exercise which Karnataka state took up. We have mapped TB patients and presumptive TB cases up to the village level in the entire state. This is the first time this exercise has been undertaken, and it's a beautiful exercise to understand the burden of TB right at the ground level. What are the priorities now? And let's look at the way forward from WHO's perspective. Number one, WHO calls for an overall hierarchical leadership which can be very much accountable for eliminating TB. There is an urgent need to increase the funding. There is also a need to have universal health coverage packages. We will need to address drug-resistant TB and also look at programmatic management of TB preventive therapy, plus reducing the stigma and the human rights part of it, plus having meaningful engagement with the private sector and civil societies. This is one slide which tells you about what is happening in the diagnosis field in our country. So this gives you a bird's eye view of how many labs and what is the infrastructure which TB program owns. What is the way forward? The way forward is to establish sentinel surveillance using whole genome sequencing for TB. With regard to treatment services, we have gone a long way, especially with regard to treatment of drug-resistant TB, where we are now offering bedaquiline and delaminid right from age 5, and also piloting the usage of bedaquiline among pregnant drug-resistant TB patients. We are now having drug-resistant TB centers in almost every district in the country. The way forward is to have enough of coverage of universal drug susceptibility, shorter, effective, all oral regimens. Please note down this point that there is no more injectable regimen in the program today. All the regimens, whether it is for drug-sensitive TB or drug-resistant TB, are all oral regimens. Plus, we are moving towards digitalized technology. I think you're all well aware of Nikshay, which is a case-based, web-based system. The biggest game changer for this year is PMTPT, Programmatic Management of TB Preventive Therapy, where we are offering treatment to those household contacts of index microbiologically confirmed cases who are even above 5 years. So this would be the game changer. In Karnataka, almost all the districts have started IGRA. There are a few which are on test and treat model, and there are a few which are on screen and treat model. And some of them may be in the process of signing MOUs between labs. Again, as I've already told you, this is 1 year where we had the highest level of advocacy for community engagement and response. There are a lot of upcoming tools with regard to artificial intelligence in terms of automated chest X-ray reading, automated reading of LPS strips, using cough to sense TB, and then we have AI solutions to predict loss to follow-up. Plus 2 other things which are majorly in pipeline is CYTB, which is just like our tuberculin skin test, but in a way different. It is better than both TST and IGRA for detecting TB infection. And all of you must vouch and say that the biggest battle will be won when we have a TB vaccine coming up, even for adolescents. So this is what the whole world is awaiting. With this, I thank all of you for a patient hearing. Thank you.
Thank you, Dr. Shazia Anjum, for elaborately speaking about the strategies the country and the globe has. I mean, we appreciate that global TB targets are to be achieved by 2030, that the commitment shown by the Prime Minister, Honorable Prime Minister, to achieve elimination by 2025 is really great. And also, we also admire the steps taken by the state of Karnataka to have Kshaya Mukta Karnataka by in the year 2021, and also Kshaya Mukta Grama Panchayata. That is also a very appreciable steps taken by the state program. And we are also happy to note that in the subnational certifications, 9 districts have obtained the bronze, and we hope that many more districts in the coming days will achieve gold or silver medals in this subnational certification. We are happy to know that, the National Prevalence Survey, you said like 90%, 50% of patients had no symptoms, but still chest X-ray are being seen as positive. So that is one concern to identify the presumptive TB patients in the coming days. And I think Karnataka is equipped with a good diagnostic molecular diagnostic techniques. And it is accessible by all people at all levels for these services. And Pradhan Mantri Mukt Bharat Abhiyan program, which was initiated by September 2022, it's a really good program. We have received very good feedback from the sectors, especially the corporate social sectors. And Karnataka, as you have said, that many steps have been taken by you and your team in enhancing and expanding its coverage across the state. With this, I thank Dr. Shazia Anjum for presenting TB elimination strategies very clearly to this group. Thank you very much. Now, I would open the session for questions among the audiences. If anyone has questions, please raise your hands. Yes, sir.
Good morning, everybody, and it has been a fantastic presentation. Congratulations, एकदम जबरदस्त रहा. अरे मेहरबानी करके बोलो यार, only questions नहीं, comments, rebuttals.
Sir, sorry, sir, I did not hear comments.
No. If you say only questions, I don't have a question. I have a statement to make.
Yes, sir. Statement, questions,
Permitted?
suggestions, anything,
Okay, ma'am.
sir.
Here is a question which I read many years ago. Even in United States, with all the facilities, I am recalling that with the mathematical models, next 400 years, you cannot eliminate tuberculosis. असं म्हणतात, अनమాట. What is your comment on the subject?
Sir, I think there's a clear difference between eliminating TB and ending TB. What we are eyeing by 2025 is ending TB, which means we would reduce the burden of incidence by at least 80% of what it was there in 2015. When I talk of elimination, it is a very, very long way to go because we have to come down to less than 1 case per million population.
Very good. I am very happy. I saw one PG examining one tuberculosis case with a sweater on. I said, ऐसा इम्तिहान किए तो tuberculosis कहाँ डिटेक्ट कर सकते हो उसको एटलीस्ट अबाउट द अम्बिलिकस नंगा कराना उसको. See, these are the अंडा का फंडास. We are seeing it. We are talking about metaverse. We are talking about intelligence. आपका स्लाइड तो एकदम जबरदस्त रहा, बहुपराक. But my basic question is, when you are on the spot, at least do you have the courage to tell that PG, please strip the patient and observe here. वो करते नहीं. People have not examined the abdomen for dovey abdomen. They have not taken the menstrual history in a woman. I am requesting you to revisit those things. Okay, your presentation is fantabulous. Arrangements are fantabulous. Having said it, अंडा का फंडा के तरफ भी ध्यान दीजिए. Thank you very much.
Well agreed, sir.
Dr. Suman.
Dr. Shazia, as you said, 50% of asymptomatic cases had X-ray finding. So based on this, any further progress in diagnosis of TB has been done? Any further research has been done?
Thank you for that, sir. I think we all have forgotten our age-old screening tool, which is X-ray, which actually came up as an elixir in the National TB Prevalence Survey. So out of all the TB patients which were diagnosed through National TB Prevalence Survey, there were 2 tools which were used. 1, symptomatically screening them, and 2, putting them all on X-ray and looking at clinical signs. So this is where is one point where every state and every district must put X-ray as an upfront tool for screening TB patients. Of course, not for diagnosing TB patients, and that will also pave way for microbiological confirmation to the next machine or the CBNAT or the TrueNAT machines. So we all have forgotten X-ray. Let's place X-ray as the frontline screening tool for every college with every PHA and every CHC.
Sir, Dr. Harivansh Chopra, sir.
Thank you. First a comment and then maybe a question. We all know that tuberculosis in community exists in 2 pools. One is the infector pool and other is the non-infector pool. And what you are suggesting as far as the X-ray is concerned, are you trying to identify first the non-infector pools, or our focus should be to enhance the coverage of the diagnostic to every nick and corner of the country so that we are able to identify the people in the infector pool and make them non-infectious? What should be the strategy?
I fully agree with you, sir. I think both the strategies should be on their climax now because we are heading towards ending TB. But as you have rightly said, we always have to look forward to capture and clean the infectious pool and then think of the non-infectious pool.
Yes, sir. Any other questions or comments? Sir?
Shaja, it was really a wonderful presentation. I just want, because being in a TB program for 11 years in the past, I really tell that from the RNTCP, it has gone to NTEP, it's a wonderful thing. But one thing I just want to know, COVID vaccine, we could get it in, as you know that the entire genome is, the first genome what we know is a TB bacterial genome. So why we are not in a position to explore the vaccines? This is what I just, whether the research is not happening in those, it's not been seen by at that time, because when we go for a NTEP, vaccines are the one which play a major role. As I feel that, can you, if you can throw some lights on that.
Thank you, ma'am. I shouldn't be spilling the beans here, but then to answer to ma'am's question, there have been a number of vaccine candidates, almost 14 vaccine candidates which are in the pipeline. Most of them have reached phase 3. One of them is VPM 1002, the other one is MTB-VAC. Now, when I speak of VPM 1002, it is almost like a recombinant BCG vaccine which can be administered to the adolescent group, especially maybe the school ending group or the early college days group, which will act as a booster to the erstwhile BCG. So I will not be able to, disseminate more on this as of now because of ethical issues, and definitely the vaccines are on the ground. Probably by next year, early next year, the vaccines might come to the field. So this is the latest update which we have received both from WHO and Government of India just last week, ma'am.
Thank you, ma'am. Thanks all the participants for raising the questions and the concerns.
Reddy, you have to say something.
I think I congratulate Dr. Shazia for a beautiful this one. So these presentations we are having last 10 years, in fact, we are looking at. In fact, I vividly remember Dr. Sangeeta was there. We were some of the first people to enter into the TB control activities those days. But if we see from 98 to 2007, we were going to all the medical colleges to fight and impress them. Intermittent regimen is very important, adopt that, adopt that, adopt that. 2015 onwards, we are telling intermittent regimen is bad, you adopt regular regimen, regular regimen, regular regimen. So if you see here, sometimes the over-ambitious goals are going to be our roadblocks actually. I was stunned, Karnataka 20% reduced, 40% reduced in 40 years, even not 10% reduced. This is something what we are trying how to grab the awards rather than really getting into the bottom. That myself was involved in the field last 1 year into the subnational certification and all. I think TB, like vaccines, though it's ethical, now it is in the public field also, so to know that. Vaccines, we know that Dr. Sangeeta told, just like that we got probably in 1 year, no other disease we got vaccines less than 1 year other than COVID. But in HIV, probably highest research done for last 2 to 3 decades, that came handy for COVID actually. All the knowledge that was accumulated in the vaccine research actually came handy for COVID. But the same could not come for tuberculosis. Of course, there are reasons why the vaccines for even leprosy or tuberculosis are not serving the purpose they are supposed to be serving. So there are epidemiologically, I think everybody is aware about that. So with all these limitations, I'm sure, though the efforts are very impressive, but that TB elimination or you say end TB is different from elimination TB. These are all terminologies we can always say. So earlier we used to say control, eliminate, eradicate. Now we say end, eliminate, eradicate, and exterminate. We use sometimes exterminate also. So anyhow, so let us see, maybe in next 5 to 10 years, we really see a light of the day.
Sir, quick 10 seconds only. How many PGs are here? Okay. If you have read the Economic and Political Weekly of India, I compliment you. If you are not, उसमें पढ़िए ज्ञान का भंडार है. And there was a man called D. Banerjee from JNU. He has written a book, Health and Family in India. It's a fantastic book. Even tuberculosis patients are given cough mixtures and got rid of it. For further details, Reddy and I am available here for the next 24-48 hours. Thank you.
Thank you all the seniors and everyone.
Just one comment. So while we are on the vaccine topic, it is very good initiative that we are starting nutrition support for TB patients. But what we have seen in our recent trial, the Rations trial, is that by giving nutrition support to the families who are at the highest risk of infection and then disease. So if we are able to improve their nutrition, 35% reduction in incidence in the contacts is a very big achievement. And if we are talking about vaccines, we have a vaccine which we are not, it's very cost effective and everybody will be happy with it. So I really feel nutrition support, not just for the patients, we really need to start thinking at population level as well. Thank you so much for that 1 minute.
Thank you everyone for sharing their thoughts. Thank you Shazia ma'am for your time as well as that wonderful session delivered today. In the paucity of, due to paucity of time, we shall move to the next session. I hand over to you, Dr. Prachet. Yeah, thanks a lot.
Thank you, everyone.
So thank you, Dr. Shazia, for that excellent talk. I now request the chairpersons to kindly present a certificate and memento to the eminent speaker, Dr. Shazia Anjum. Thank you for that excellent and very informative talk on TB elimination strategies, challenges, and the way forward. So I now request Dr. Parimala S. Marur, Director, State Institute of Health and Family Welfare, Bangalore, to kindly felicitate our chairpersons. Dr. Sharath BN. And Dr. Akshaya KM. Thank you, ma'am. And I thank Dr. Sharath and Dr. Akshaya for chairing this session. So, moving forward, we now have the keynote address on the topic Sustainable Development Goals, Localization, Equitable Access to Basic Healthcare Services, EWIN, COWIN, UWIN. So may I now request the chairpersons for this session, Dr. B. Unnikrishnan, Dean and Professor, Department of Community Medicine, Kasturba Medical College, Mangalore, Manipal Academy of Higher Education, and Dr. Anna Rao G. Kulkarni, the President of IAPSM Karnataka State Chapter, Professor and Head, Department of Community Medicine, East Point Medical College, Bengaluru, to kindly come up the dais and please occupy your seats. I now request the guest speaker, Dr. Pankaj Somani, who is the Senior National Program Manager, Health System Strengthening, Health and Governance Unit, United Nations Development Program, New Delhi, to kindly come up the dais and occupy your seats, sir. So let me introduce our eminent chairpersons for this session. So first of all, we have Dr. B. Unnikrishnan, Dean and Professor of Community Medicine, KMC Mangalore, Manipal Academy of Higher Education, Manipal. He's one man who needs no introduction. He is a role model to many young faculty, including me, because he's such a distinguished faculty member. His areas of interest include health systems, research, evidence synthesis, and health policy. So, sir has innumerable achievements, and this is just the tip of the iceberg. He's been a member of the advisory board of the JIPMER Research Leadership Mentoring Program at Pondicherry. He's been the associate editor for BMC Public Health Journal, academic editor for PLOS ONE, academic editor for AIDS Research and Treatment, and the editorial board member of Indian Journal of Community Medicine. He is one of the top researchers in the country. He's published more than 260 articles in peer-reviewed Scopus indexed journals, including Lancet and Nature. He's been the member of the NAC peer team and is a well-known NABH assessor as well. He has won many awards. Very recently, he has featured in the world top 2% scientist list by the prestigious Stanford University for Research Publications up to the end of year 2021, which is a great achievement. He's also been serving as a member of the governing board of Cochrane. So the Cochrane has admitted him to the membership of Cochrane collaboration from the year 2018 to 2023. So we are really blessed to have you with us, sir. So now let me introduce our chairperson, Dr. Annarao G. Kulkarni. So Dr. Annarao G. Kulkarni is serving as the president of the IAPSM Karnataka State Chapter. He is a senior faculty who was earlier the professor and head of Department of Community Medicine in KVG Medical College, Sulya. He is currently serving as the professor and head Community Medicine Department at East Point Medical College, Bangalore. His areas of interest include primary healthcare and non-communicable diseases. He has many achievements. He has been instrumental in establishing an urban health center in Dharavi, one of the largest slums in the country, while serving in Mumbai. He has developed a primary healthcare system in Gizan province and preventive medicine department in the Ministry of Health Kingdom of Saudi Arabia. He has many honors to his credit. He was the first to Mumbai University in DPH. He's been the founder president of the Intercollegiate Academic Program for Postgraduates, and he's been serving as the president of the IAPSM Karnataka State Chapter. So we are indeed honored to have you with us, sir, as our eminent chairperson. So I now request the honorable chairpersons to kindly take over this session. Thank you.
A very good morning to one and all. First of all, let me thank the organizers for giving me this opportunity for sharing the keynote address. It's my proud privilege to introduce you the eminent speaker, Dr. Pankaj Somani, who will be delivering the keynote address. He is the Senior National Program Manager, Health System Strengthening, Health and Governance Unit, United Nations Development Program, UNDP, New Delhi. He is a member of IAPSM and member of IPHA. His areas of interest are reproductive, maternal, newborn, child health, and adolescent health with interest in immunization, digital health solution, non-communicable disease, neglected tropical disease. His major achievement as a national resource person and technical lead for Electronic Vaccine Intelligence Network, EVIN, and CoVIN, implemented the program in all 29,450 cold chain point vaccine stores across 36 states and union territories of the country. As a sole resource person from India, implemented EVIN in Indonesia. Awards and honors, he was the guest speaker for Electronic Vaccine Intelligence Network at 12th Joint National Conference of Indian Society for Malaria and Other Communicable Diseases and Indian Association of Epidemiologists 2017, held at AFMC Pune in September 2017. The EVIN program in the state of Madhya Pradesh, led by him, received the award for the best practice in public health at the National Health Summit held at Tirupati in the year 2016. He was the guest speaker for Call to Action, Health System Strengthening, Quality Improvement, and RMNSCH plus A Scale-Up at Joint Annual Conference of IAPSM and IPHA Gujarat Chapter, January 2014. It's my proud honor and privilege to welcome Dr. Pankaj Somani, and he will be delivering the keynote address on SDGs localization, equitable access to basic healthcare services, EVIN, CoVIN, UVIN. Thank you.
Okay. Yeah. Thank you, chairpersons. Once again, good morning to everybody. And on behalf of UNDP, I thank Yenepoya Medical College and the IAPSM Karnataka chapter for giving us this opportunity to be associated with this mega public health event. And my topic, the topic which was given to us is regarding the roadmap to SDGs. Basically, I'll be talking about the digital health solution which UNDP is providing to Government of India.
and basically for the immunization program in India. All of you must have heard about even, may not be, but yes, COVID definitely. All of you are vaccinated, I hope. Yes? Can I get a yes from everybody? All of you are vaccinated for COVID-19 vaccination. Okay. So even COVID and UVIN, I'll be talking about these three solutions, how they contribute to SDGs and how they contribute to the basic healthcare services. So thank you, Chair, once again. So the content of my presentation will be on EVIN, then the techno-economic assessment of EVIN and how EVIN has contributed to SDGs, then leveraging the learnings from EVIN for COVID, then leveraging the COVID infrastructure for UVIN, and then the learnings. So before I go to the problem statement, just give a thought. If the armed forces, I'm very close to armed forces, I did my MD from AFMC. So just a question to everybody. If the armed forces, they don't have bullets, what will they do in war? Any guesses? They may resort to hand-to-hand combat, right? Or the guerrilla warfare. They can. They will not let the war go, right? But what if the magic bullets, the vaccines, if they are inadequate or they are short with our healthcare workers, will they be able to give just the injections, mere the saline injections? No, right? So that's the importance of stock availability of the vaccines. Let me just talk about it in detail. So the problem statement which Government of India started with in the year 2012-13, roughly near about that, was to improve the full immunization coverage, to reach the unreached, equitable distribution of services, and reduce out-of-pocket expenditure, especially for the immunization services, and the problem arising out of that. If you look at the immunization program of India, it is one of the largest public health programs in the world. I don't think so even China has such a large program. This is free of cost, of course, and the target population is almost 30 million pregnant women and 26.7 million birth cohort every year, and with approximately 12 million sessions. And when I say sessions, they are basically the immunization sessions or the VHNDs which are conducted in the field, maybe fixed or outreach sessions. Almost 29,000 cold chain points or the vaccine storage points, they store these vaccines for such a huge population of our country. And there are 12 antigens, almost you can see on the slide. All of them are almost national, except two, typhoid and JE, which are only in few states or districts. India is the largest manufacturer and even exporter of vaccines, and we have got a functional national regulatory authority for the vaccines as well. If you look at the supply chain of our country, it's a very complex 6-level chain. Right from the country level, the highest level, national level, or even if you include the manufacturers, we have the central stores, then we have the state stores, division stores, district, taluka, and the sub-district hospitals or the CSC and PSCs, even sub-centers in few of the remote areas. So it's a very complex 6-level vaccine supply chain. And there are various challenges for this vaccine supply chain. The first and foremost is lack of real-time visibility of the stock at any level. So before 2013-14, when EVIN came into picture, there was no real-time visibility of the stock. There was no visibility of storage temperatures. How are the vaccines stored? Where are they stored? Then all these vaccines, they have got very short shelf life and a very long supply chain. So once the vaccine is manufactured, it undergoes various tests in various laboratories, and only then it is sent to the system. So it takes a long time, and they have got a very short shelf life, roughly about 2 to 3 years, not more than that. Then before EVIN came into picture, the record-keeping practices were not standard. Although there were formats, but they were not into practice. There was a mismatch in demand and supply, and very limited infrastructure as far as the cold chain points are concerned. And the biggest of all, lack of transparency of the data, of the stock. So to answer these and few more critical questions which the program managers will have, where are my vaccines? Are they in adequate quantity? And are they stored in recommended temperature? So these are the three basic questions which come into any program manager's mind, whether at the national level, state, or district level. So Government of India thought that let's have a digital system which can answer all these questions and the challenges of the supply chain. So what they did is they thought of having a computer-based system. But what is the major challenge again? The unavailability of the data entry operator at all the health facilities. Do we have those? No, we don't have. Even if we have those, we may not have the internet access. The functional computer unavailability. Most of the times there is just single computer at the health facility which is being used by some other programs. So that's not available to the cold chill handler. And poor and erratic electricity supply are throughout our country. So to answer this, they need to have something which is very portable, which is handheld, which is handy, and vaccines will work only when the vaccine supply chains will do. So to answer these questions, even came into picture, which is a smartphone-based technology, or I would say a cloud-based technology, wherein all the transactions are being done on an app, mobile-based app. It's an Android app. So how it was operationalized? First, there was a pre-assessment, or you can say a metadata collection or situational analysis, that where are the cold chain points, where are the stores, where are they located, who are the users handling the vaccines there. So all that assessment was done. And let me tell you, this was not a sample-based. It was throughout the entire universe. All the health facilities were visited by our field level workers, and then that data was collected. Based on that data, even app was formed, and then the users and the managers, the store managers, they were trained. Ultimately, the vaccine was digitized, vaccine stock was digitized, and then the temperature loggers were installed. So even answers or even ensures the quantity and quality of the vaccines. And ultimately, soon after the installation of the loggers, the even performance and various indicators were monitored, and they are monitored now as well. So this is how all the stores were mapped across the country, just to get this cold chain network of a state. How the vaccine flows from top to bottom, right from the state store to divisional, district, and then to the last cold chain point, or to the last mile. Even GPS coordinates of these health facilities were taken, just to if you can see in the, I think it's back to if you can see in the map, this is the map of Himachal Pradesh, one of the state, a very hilly state. Almost all the cold chain points, they are all aggregated in the southern part of the state. And the northern part is almost devoid of the cold chain points. So this gave the policy makers, they took a decision that let's increase the number of cold chain points in those areas as well. Yeah. You can see. So ultimately, the even solution was first standardizing the stock keeping practices on the registers, the primary source of data, and then digitizing this data into the app, the logger installation, the cloud-based server to get the data from the loggers from the mobiles, the mobile apps. Ultimately, the real-time stock and temperature visibility in form of dashboard and reports to the managers. And in the whole process, the vaccine cold chain handler who is handling the vaccines, they are digitized, they are empowered, they are digitally empowered. So how it works? The cold chain handler or the healthcare worker, he or she enters the issue, receipt, stock counts, all the transactions related to vaccines on the app. The temperature goes to the cloud server, and ultimately the healthcare worker, all the managers, especially the district immunization officer who are there at the district level, the state immunization officer at the state level, and the national level, the ministry, the immunization division, they are able to get all these data in a simplified dashboard and simplified reports in their hand, and everything is real time, right? So based on that, they take decisions for relocation of vaccines. You have seen a massive vaccination, COVID-19 vaccination recently. How do you believe, do you believe that without this even system or without this COVID, which I'm going to talk about, will it be possible to vaccinate almost 1.1 billion beneficiaries? So this has helped a lot in the stock management of COVID vaccines as well. This is an open source. What do I mean by open source? It can be integrated with any of the available softwares. So moving forward, this will be integrated with many other softwares like HMIS and RCH and many other softwares existing. If you see the coverage, all the states and UTs of our country, they have even, all 29,000 cold chain points. There's 100% adherence rate. The activity rate is almost 99% weekly, if you see. This is what the cold chain handlers do. And almost 50,000 healthcare workers, they have been trained for this, and they are working regularly. Based on the feedback from the ground and based on the continuous improvement, even has undergone a lot of changes. From the Java-based mobile phones to the latest version of the, in the smartphones and the app. I mean, it keeps on improving. Connecting the first mile, like I said, all the nodes of the supply chain, they are connected with the server, and the reports are also sent to all the points, all the nodes. So big data architecture, it gives actionable analytics for efficient supply management. It enables optimal decisions to ensure stock distribution and availability across the stores. Even is a very good example of theory of change. I believe all the PGs here, at least they must be talking of this theory of change in their curriculum. So if you see the process and inputs for AVIN, the HR, the infrastructure, product and commodities, and the guiding principles of innovation, implementation at scale, all these are there in AVIN. Ultimately, it leads to output and outcome in form of accountability, transparency, effectiveness. I mean, a system is built which is transparent, effective, and efficient. And ultimately, the aim was to improve the service delivery mile, at the last mile, which is accessible, affordable, and available to the general public. And this is what it has done. EVIN contributes to the sustainable development goals as well. And how? Let's see. If I talk about the goal number 3, good health and well-being, it contributes to an improved vaccination coverage, thereby reducing the morbidity and mortality due to the vaccine preventable diseases. Then gender equality. Majority of the cold chain handlers, they are females in our country. And almost all of them, majority of them are 40, 45 years plus. So these female cadre, this female workforce was digitally empowered with this system. Then reducing inequalities. Even ensures equitable and efficient distribution of vaccines to make sure that no child is left behind. Then even strengthens the health system by streamlining the processes and providing the real-time data on stock availability and the temperature of the storage points. Partnership, yes, it collaborates and coordinates with the government, with the partner organizations, and this is how the institutions are built. As said, there was a techno-economic assessment of AVIN which was conducted by Government of India in the year 2018, and it was found that the return of investment in AVIN was almost 1:3. I mean, if you invest $1, the return was almost $3. I mean, including the cost of HR, infrastructure, all the processes, everything. Even then, it was a very beneficial or cost-effective system for the government. So it is a very it's a replicable. I mean, it has been awarded as one of the best practices in the health and the public health at one of the summit, the National Health Summit. So this is all about AVIN. Moving forward, this will be integrated with the softwares like CoWIN and then going to UWIN, which I'll be dealing now. Even the manufacturers will be on board so as to have the end-to-end solution for the supply chain. Utilization of big data architecture. All our planning will be consumption-based rather than target-based planning. And then we'll also have the advanced temperature monitoring for the transportation as well, not only just for storage, but also for the transportation. Now let me talk about CoWIN, which is the technical backbone of India's COVID-19 vaccination program. All of you know that it was launched, COVID-19 vaccination was launched on 16th of January 2021 by the Honorable Prime Minister. It is the first adult vaccination program in the country and globally the largest cohort to be covered in terms of target, human resource, logistics. It's the biggest vaccination drive. So how do we do it? You must know about this, you must have known about this COVID-19 vaccination policy. It evolved gradually. I mean, to start with, all the healthcare workers and frontline workers were included for the vaccination. Later on, the elderlies were added to the, for the vaccination. And then the age group, many other age groups were added, so on and so forth. Yeah. So currently we are having not only just 2 doses, but also precaution doses for all the beneficiaries. So how do we handle this vaccination? A system called COVIN, initially it was COVIN, COVID Vaccination Intelligence Network, but then our Honorable Prime Minister renamed it to COWIN, COVIN, winning over COVID, with the help of this system. So already Government of India had this logistics management system in form of EVIN, wherein the vaccines were tracked from the manufacturer till the primary health center level or the cold chain point level. So to add to that, Government of India asked us to go one step ahead. Once the vaccine carrier reaches the session site, the beneficiary reaches the session site, and also the vaccinator, when all these three merge, then we can have the COVID-19 vaccination for the beneficiaries. And the product will be a QR code based certificate, which is given to the beneficiaries then and there itself with a unique health ID. So this is what is the beneficiary acknowledgement. So once the beneficiary is there, he is vaccinated and he gets that acknowledgement. This was for the first time in the country, right? And also if there are any AFIs, adverse event following immunization, those can also be reported on this very software, with this very platform. So again, the policymakers, in terms of COVID, I'll show you how the dashboards and reports are not only just available to the policymakers, but at each and every level. We'll look forward. So COVIN, it's a scalable, inclusive, and open platform for universal vaccination with equitable and inclusive guiding principles. And what do I mean by that? It has got multiple modes of registration. It is across the state, multilingual states. It is there in all the states. It's a single source of truth for the policymakers and also for the beneficiaries. It has accommodated so many changes. You won't believe, in last 1.5 years, in fact, almost 2 years now, it has underwent almost 140 changes. There are 140 versions of COVIN software. And I think ma'am must be from the health department, she must be knowing that. I mean, the way healthcare workers have adopted to that changing system as well. I mean, one day before the system was changed or the app was changed, and the very next day, the healthcare workers were using them on their app. The same app was being used by them. So this is how it accommodates changes, and there were no glitches as such. Based on the feedback analysis, it has underwent many changes. Initially, AFI reporting was only by the health department. Later on, the self-reporting format or the self-reporting platform for the AFIs was also added to it. So for the first time in the country, a digital system which ensured the acknowledgement, which is verifiable and traceable. So if you go to any hotel or say at the airport, you just need to show your QR code certificate. They will scan it and they can see that yes, you have been vaccinated. You need not show your certificate as such, right? Then the dose intervals, they were maintained. All the validations. So in our country, we have a homologous vaccination, right? A person who is vaccinated for Covaxin will be getting Covaxin, Covishield. So all these validations were there in the system. If I have to go and vaccinate for my precaution dose, I'll be seeing all those sites, all those vaccination centers where Covishield or Covaxin is available. So all those validations are there in the system. For the citizens, what are the advantages for the citizens? Digital and offline walk-ins. I mean, we kept in mind the digital literacy of our country. It's not very high. Of course, people are using WhatsApp and many other social media platforms. But when it comes to using the app for some work or for some service, that may not be very high, especially in the rural areas. So even the offline walk-in site registrations were also added to the system. Vaccination schedule can be tracked. Convenient time and location for the slot booking. All these were blended in that. And instant digital certificate. So, like I said, modes of registrations are many. Assisted registration. Even at the Gram Panchayat, if people are not able to go directly to the site, people sitting at the Gram Panchayat level or at the sub-center level, they assist them in getting the registration done. Finding the vaccination center, not just by location, but also through the map. Just by navigating on the map, you can find your vaccination center. And then minimal data inputs. We were very careful while asking for the data. Nowhere the address was asked from the beneficiaries. It was just to keep the system portable so that if a person who is vaccinated in Karnataka can be vaccinated in Delhi, and a person who is vaccinated even abroad can be vaccinated in our country. So that portability was kept into the system so that it is accessible to everybody. Now, open APIs. I mean, all of you will believe, you must have seen, you can, in your daily routine apps also, Paytm or many other apps, you can book slots for, say, movies for a particular theater. Same way, in all these partner apps, you can book the slots for COVID-19 vaccinations. So that interoperability is there for COVID, and that enables this innovation. Yeah, that's the same thing which I said just now. Now, one very important part for the private facilities. They have integrated this app with their own existing softwares, which were there in their hospitals, so that the user or the user interface remains same, and then the vaccinator or the person who is handling this app it was very easy for him or her to use this app. Certification APIs, I have already dealt with that, and robust API policy. So anybody who wants to integrate with this COVID software, they can simply apply to the Government of India, and then they would get a certificate to apply for this, to integrate this app. What are the benefits for the managers and vaccinators? It was very easy, again, to create these session sites, to create the COVID vaccination facilities, even to edit them. Because we have seen many vaccination centers were created. Later on, when the pace was slow, they were deactivated. So all these features were there. They can be edited. And the vaccinators, they were able to see the beneficiaries who are going to come today for their sessions, how many beneficiaries are going to come, which vaccine are they supposed to administer. So all those details were there for the vaccinators on the app. For the policymakers and administrators, it's not changing there. Yeah. So transparency of data for all these stakeholders. I was stuck. It's getting. Okay, thank you. So for the policymakers and the administrators at the highest level, they get all these reports, the vaccination center, citizens registered, number of doses, all these reports. But what I was telling you about, that in COVID, the dashboard and reports are available even for the general public also. You can see for the hospitals and vaccinators, policymakers, state and district administrators, and even for the citizens, and even for the foreign entities. So the dashboard and reports, they're all customized and are made available to all, at every level. So what are the strategical features? Location details not captured, I have already told you. It's a very portable system. Multiple registrations. Almost 6 members can be registered through one mobile number. On-site registration and special sessions for people without identity card, near to home, workplace CVCs. All these were created on COVID. Can you imagine how the jail inmates who are there in the prisons, or the Naga sadhus or the migrants, how will they be vaccinated if they don't have any, say, I-card? So all those provisions were made in COVID, and they were vaccinated. It does have a grievance redressal mechanism. It has 2-tier grievance redressal mechanism. One for the public, for the beneficiaries. The other one, there is a higher level, which is a call center or a helpline. You can get your name, age, any changes in the certificate, they can be done. Incorporating the passport number, if you are traveling abroad, those can be done. Regenerating the certificate. So all these facilities are available. There is a 24/7 call center, which is working, and there are dedicated technical helpline. If the frontline helpline is not able to solve the issue, it is escalated to the technical helpline. So the achievements, all of you are very well aware of the achievements. Almost 1.1 billion citizens have been registered, 85% on-site and 15% online. So that's the beauty of this software. Almost 2.2 billion doses have been administered using this software. It's a massive data which I don't think so anywhere else in the world has been captured. I mean, the amount of data which is there on this. So these are all figures which you can see. So now what about the sustainability of CoWIN? It was the fastest tech platform globally to amass 1 billion registrations in less than 12 months, let me tell you. And we have handled almost 13.7 million registrations within 8 hours of opening. I mean, when 18 to 44 was started, you can see almost 13.7 million registrations were done within 8 hours. So that's a huge, huge number. Yes, minimal data inputs are taken, and the privacy and security features are all there. So Government of India has already had 2 pillars now, EVIN and CoWIN. EVIN for the supply chain management, and now CoWIN for the beneficiary tracking. Based on these two, or leveraging the learnings from these two, Government of India has come up with a new innovation, that is UWIN. UWIN is nothing but UIP, or CoWIN for UIP, you can say, and UIP is Universal Immunization Program. So getting the best of these 2 pillars, the first 2 pillars, EVIN and CoWIN, the third one is into making. So what is the advantage of having or utilizing these existing softwares? As you know, already 1.1 billion beneficiaries are registered on CoWIN, and almost 250,000 or 2.5 lakhs vaccinators are registered on CoWIN, and all these healthcare workers and the entire health system is well versed with CoWIN software. So coming up with another software, UWIN, which is almost alike CoWIN, will not be a difficult or will not be a big challenge. It has got a very technically sound architecture because it has handled a large amount of data, and already the human resource network, which is there, which has supported EVIN and CoWIN, that same HR network will be supporting UWIN. There are just 5 modules in this. The first one is the registration, then the mobilizer module. First time, the ASHA workers or the link workers will be digitally empowered again. Session planning module, how the sessions will be made. The delivery point module will be there. And the healthcare worker, ultimately the vaccinator module. All these modules will be there. So this is my last slide. So what we have learned so far, or what the Government of India, what we have seen, if there is a strong government ownership with a dedicated and skilled human resource, with SOPs, with the standard operating procedures, and regular capacity building and review mechanism, any software or any digital solution can do wonders, and ultimately it can contribute to the SDGs. As far as the technical aspects are concerned, yes, moving on from traditional database to big architecture. The age-old practice of getting the data in Excel sheets and emails and all, that is now we have moved on to the big data architecture. Authorized access to security audit and compliance, it is compliant to all the audits. Rather than having licensed products, we are opting for the sustainable open source solutions and data triangulation to API-based interoperability, which you have seen just now. So that's all from my end. Thank you. Thanks for patient listening.
Thank you, Dr. Pankaj Somani, for your lucid keynote address on SDGs localization, equitable access to basic healthcare services, EVIN, CoWIN, and UWIN. As per the protocol, there are no questions, comments permitted for keynote address, so I hand over the mic to the moderator.
Thank you, Dr. Pankaj, for that excellent talk. Thank you, sir. So I now request our chairpersons to kindly present a memento and certificate to the eminent speaker, Dr. Pankaj Somani. Thank you for that excellent and informative keynote address on equitable access to basic healthcare services, EVIN, CoWIN, UWIN. I now request Dr. Harivansh Chopda sir, National President of the IAPSM, to kindly honor our chairpersons. Dr. B. Unnikrishnan, Dr. A.G. Kulkarni, thank you, Chopra sir, and I thank Unnikrishnan sir and A.G. Kulkarni sir for kindly chairing the session. And I would like to thank the organizers for inviting me to moderate this talk. I hand this back to the organizers for the inaugural session. Thank you all.
Thank you, Prachet sir, for moderating the sessions. I also thank Dr. Nishant Krishna K. and Dr. Anusha Rashmi for reporting the sessions. I now request Dr. A.J. Kulkarni sir to hand over the certificate and memento to Dr. Prachet R. for moderating the session. I request Dr. B. Unnikrishnan sir to hand over the certificates and mementos to Dr. Nishant Krishna K. and Dr. Anusha Rashmi. Thank you, sir.
We take this opportunity to thank our partners, Bank of Baroda, Bill and Melinda Gates Foundation, Grid Council, IAPP, Karnataka Bank, Metal Healthcare, Mudrani Builders, Northern Sky Builders, Reliance Industries, Sultan Gold, UNDP and UNICEF for their help in smooth conduct of this program.
We now begin with the inauguration of Second State Conference of IAPSM, Karnataka chapter in collaboration with Intercollegiate Academic Postgraduate Program. I would like to request Dr. Poonam R. Nayak, Organizing Chairperson and Professor and Head, Department of Community Medicine, Yenepoya Medical College, and Dr. Akshaya KM, Organizing Secretary and Additional Professor, Department of Community Medicine, Yenepoya Medical College, to escort the dignitaries to the dais.
Recording
Dr.
in
B.
progress.
Sripati Rao, Honorable Pro Vice Chancellor, Yenepoya
Recording
Deemed to be
stopped.
University. Dr. Gangadhar
Recording in
Somyaji,
progress.
Registrar, Yenepoya Deemed to be University. Our chief guest for the inaugural is Dr. Nupur Roy, Senior CMO, National Center for Vector-Borne Disease Control, Directorate General of Health Services, Ministry of Health and Family Welfare.
Guest of honor, Dr. Rajendra KV, IAS, Deputy Commissioner, Dakshin Kannada District. Dr. M.S. Musaba, Dean, Yenepoya Medical College. Dr. Abhay S. Nirgude, Organizing Co-Chairperson of this conference and Associate Dean Administration, Yenepoya Medical College. Dr. Ashwini Dutt, Associate Dean Academics, Yenepoya Medical College. Dr. Harivansh Chopra, President, National IAPSM. Dr. Purushottam Giri, Secretary General, National IAPSM.
Dr. Annarao G. Kulkarni, President, IAPSM, Karnataka State Chapter. Dr. Vinay M., Secretary, IAPSM, Karnataka State Chapter. Dr. Hemagiri K., Professor and Head, Department of Community Medicine, Karwar Institute of Medical Science, and he is our KMC observer of the conference. Rabbi Zidni Ilma, O my Lord, increase me in knowledge. Quoting this verse of Quran, I request Mr. Shehzad, MBBS student of 2020 batch, Yenepoya Medical College, to invoke the blessings of the Almighty.
بسم الله الرحمن الرحيم اقرأ باسم ربك الذي خلق خلق الإنسان من علق اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم. Translation. Read, O Prophet, in the name of your Lord who created humans from a clinging cloth. Read, and your Lord is the most generous, who taught by the pen. Thank you.
Thank you, Mr. Shehzad, for the prayer.
I would now like to call Dr. Poonam R. Naik, Organizing Chairperson of the Conference, Professor and Head, Department of Community Medicine, Yenepoya Medical College, to welcome the gathering.
Respected dignitaries on the days and off the days, a very good morning to one and all. I feel honored and privileged to welcome you all for the second state conference of Indian Association of Preventive and Social Medicine, Karnataka chapter, organized in collaboration with Intercollegiate Academic Postgraduate Program at Yenepoya Medical College, Yenepoya deemed to be University, Mangaluru, with the theme Roadmap to Sustainable Development Goals. We began this journey almost 6 months back. One fine afternoon, I received a call from Dr. A.G. Kulkarni, IPSM President, Karnataka chapter, to discuss if the second IPSM State Conference Karnataka chapter can be organized at Yenepoya University by the Community Medicine Department. I, along with my colleagues, had a discussion and we thought, yes, we can take it up. With the approval and support from our university officials and management, we decided to organize this conference at Yenepoya Medical College, Yenepoya deemed to be University. I thank Dr. A.G. Kulkarni for having trusted us and giving this opportunity. Here, I would like to make a special mention that my association with Dr. Kulkarni goes back to 1998, when he was my teacher during my undergraduation at Mumbai. And it's a special privilege to continue this association even today after 25 years. This was then the beginning of a series of meetings and discussions exploring collaborations and partnerships with various national and international organizations for the conference. Here, I would also like to mention special support received from some key individuals towards this conference. To name a few, Dr. Praveen Khobragade, who was our senior during my post-graduation days, then working with UNICEF India, and later on moved to work with UNICEF Afghanistan. Dr. Narayan Gaonkar from UNICEF, and our own Dr. Harivansh Chopra, who facilitated our networking with principal organizations, and we are here today with an academic feast of scientific sessions by eminent guest speakers having a rich, varied experience in the field of public health, both nationally and globally. The Sustainable Development Goals adopted by the UN in 2015 as a universal call to end poverty, protect the planet, and ensure all people enjoy peace and prosperity. Health is well placed in the SDGs, and the goals provide a well-consulted framework which is scientifically robust, integrated, and ensure a comprehensive development. And it's very critical thereby to lay out the roadmap to Sustainable Development Goals. And thereby, with extensive brainstorming sessions, we decided this as the conference theme. On behalf of the organizing committee, we are extremely happy to extend a hearty welcome to our Honorable Chancellor of Yenepoya University, Dr. Yenepoya Abdullah Kunni, in absentia, who has been the driving force for this conference. Sir is not available today here as he is out of country for official work. But Sir has conveyed his best wishes to this program and also for the conference. We are blessed to have his good wishes for the conference. I also extend warm welcome to our Pro-Chancellor, Mr. Farad Yenepoya, in absentia, who has always encouraged us in all our endeavors and supported us in taking up new assignments and moving forward. I also extend warm welcome to Honorable Vice Chancellor Dr. M. Vijay Kumar in absentia, a renowned oncosurgeon, academician, and researcher who has been the driving force for this conference. Sir will be joining us tomorrow for the panel discussion on preventive oncology and also for the valedictory function thereafter. On behalf of the organizing committee, we are extremely happy to extend our hearty welcome to Dr. B.H. Shripati Rao, Pro Vice Chancellor, Yenepoya deemed to be University and presiding officer for this inaugural program. Sir is a well-acclaimed oral and maxillofacial surgeon and clinician. Sir has always been a constant source of encouragement for all our department endeavors. I request Dr. Abhay Nirgude, organizing co-chairperson of the conference, to welcome our presiding officer, Dr. B.H. Shripati Rao. The chief guest of today's inaugural function, Dr. Nupur Roy, Head of Kala-Azar Lymphatic Filariasis, JE, IEC, BCC and Trainings, National Center for Vector-Borne Disease Control, Ministry of Health and Family Welfare, Government of India. We are highly indebted to you for your wholehearted support for this conference and accepting our invitation. Please accept a warm, hearty welcome. I request Dr. Shripati Rao, Pro Vice Chancellor, to welcome our chief guest for today. The guest of honor for today's event, Dr. Rajendra KV, IAS, Deputy Commissioner, Dakshin Kannada, Karnataka, Organized Department of this conference, deems it a privilege to offer cordial welcome to you, sir. Thank you for accepting our invite and gracing the occasion as guest of honor. I request Dr. Gangadhar Somayaji, Registrar, Yenepoya deemed to be University, to welcome our guest of honor. Registrar Yenepoya deemed to be University, Dr. Gangadhar Somayaji KS, has guided and supported us at every stage of the conference. We offer you a warm welcome, sir. I request Dr. Akshay KM, Organizing Secretary, to welcome Dr. Gangadhar Somayaji. We have with us our national and state IPSM office bearers. Dr. Harivansh Chopra, President, National IPSM. He has more than 37 years of experience in public health and preventive medicine and pediatrics. Sir has supported us in the conduct of this conference through networking with various organizations for scientific partnerships. It's a pleasure to have you here today at the conference. We are all working towards a common goal, and your contribution is integral as an exemplary leader. Dr. Purushottam Giri, Secretary General, National IPSM, Professor and Head Community Medicine, IIMSR Medical College, Maharashtra. Our association goes back to being PG colleagues in Mumbai. He's one of the strong pillars of IPSM. Dr. A.J. Kulkarni, President, IPSM Karnataka Chapter, Professor and Head Community Medicine, East Point Medical College, Bangalore. Wishing you warm welcome, sir. And Dr. Vinay M., Secretary, IPSM Karnataka Chapter, Associate Professor, Mandya Institute of Medical Science. I now request Dr. Abhay Nirgude and Dr. Akshay to welcome our national and state IPSM office bearers. Having these committed IPSM leaders and office bearers both at the national and state will help us take another pivotal step towards the organizational goals. On this occasion, we also welcome Dr. M.S. Musabba, Principal Dean, Yenepoya Medical College. I request Dr. Abhay Nirgude to welcome our Principal Dean for all the support that we always receive in all our activities. On this occasion, we also welcome our Associate Deans, Dr. Abhay Nirgude, and also the conference organizing co-chairperson, and Dr. Ashwini Datta, Associate Dean, Academics and Professor Physiology. I request Dr. Abhay Nirgude to welcome our Associate Dean, Dr. Ashwini Dutt. So we have two Associate Deans in the frame together. We have with us Dr. Hemgiri K, Professor and Head, Karwar Institute of Medical Sciences, Karnataka, as KMC Observer. We welcome you, sir. I request Dr. Akshay KM to welcome our KMC Observer. The scientific sessions of this conference address different areas of priority that are directed towards achieving sustainable development goals and have received support from global and national organizations of public health importance, to name them UNDP, UNICEF, Bill Melinda Gates Foundation, Clinton Health Foundation, WHO NTEP, PATH, Institute of Public Health, Karnataka, Tata Memorial Hospital, Mumbai, NIMHANS, SIHFW, Karnataka, and also from the state and government of Karnataka and government of Andhra Pradesh. We also have representatives and support from the different organizations in the NGO and the private sector, and stalwarts from the academic institutions of Karnataka and Kerala. I am sure the deliberations of this conference will serve as useful recommendations for policy and advocacy. We look forward to long-term partnerships with all and working towards setting the roadmap to SDGs. On this occasion, I also welcome the state and district officials from Health and Family Welfare Department and program officials. I welcome Dr. Prakash Saldana, Medical Superintendent, Yenepoya Medical College Hospital, Professor Kutti, Professor Abdul Rahman, Deans, Associate Deans of all constituent colleges, center heads, Dr. Javed, the Finance Officer, Mr. Narendra Kamath, Chief Admin Officer, Mr. Pankaj Akshan, all university officials, Mr. Asim Said, CEO, Yenepoya Technology Incubator, and his team members who have developed the conference website, which has facilitated all the pre-conference and also the conference execution related activities, heads and faculty of various departments to this inaugural program. A very warm welcome to all our distinguished resource persons, and I am sure all the delegates are full of enthusiasm and looking forward to hear from you. Your skill set, creative mindset, and experience will positively impact our participants. It's such a pleasure to have with us today our faculty and postgraduate alumni with us at this conference. It takes us down the memory lane and makes me proud to see their professional growth and contributing immensely to the field of public health. They have been with us for the development of this particular department where it is today. So I acknowledge their contribution. I welcome Dr. Akshay KM, Organizing Secretary, Dr. Imad Muhammad Ismail, Joint Organizing Secretary, my team members, all my department colleagues, postgraduates, PhD Junior Research Fellows, support staff who have been with me throughout. And it's not only for this conference, but every activity, it's our teamwork that gives us the courage to stand strong and accept and face newer challenges positively. Faculty from other departments and all our student volunteers have extended their support towards smooth conduct of this conference. I welcome you all. We extend a hearty welcome to our friends from press and media for the media coverage that we have received in the last 2 days and also for today's event. We have more than 250 delegates participating in this conference. Yesterday, we also had the pre-conference CME on scientific paper writing and research integrity, where we had more than 50 delegates with eminent resource persons. We received encouraging feedback from the participants in terms of excellent organization, relevant topics with practical demonstration of certain key skills related to research, and the overall feedback score was 4.8 out of 5, which is really very encouraging for us. This is a state chapter conference, but I'm glad to see delegates having come from different parts of the country, and this provides us a platform for sharing of strategic solutions and best practices being implemented across the various geographical regions of the country. I hereby welcome all who are here with newer perspectives and ideas and hope we bring a new dimension to our conference. Welcome you aboard. Looking at the scientific session schedule, the other day one of the senior consultants mentioned, Madam, you have power-packed scientific sessions and resource persons built in your program. So I'm confident that there's going to be transfer of this high-power, knowledgeable energy to all the delegates and participants having assembled for this 2 days conference. Wishing all of us a fruitful learning over the next 2 days. Thank you.
Thank you, ma'am, for delivering the welcome address. Shubham karoti kalyanam, arogya dhana sampadam, shatru buddhi vinashaya, deepa jyoti namostute. On this note, I invite all the dignitaries on the dais to light the lamp and inaugurate this event. Thank you, everyone. Our next event is release of the souvenir of conference. A souvenir is a keepsake to remember an event which has all the key events of the conference along with scientific abstracts and sponsored advertisements. I request the dignitaries on the dais, our chief guest Dr. Nupur Roy, our guest of honor Dr. Rajendra KV, and our presiding officer Dr. Shripati Rao to release the conference souvenir. I thank all the dignitaries on the dais for releasing our conference souvenir.
Our guest of honor today is Dr. Rajendra KV, IAS Deputy Commissioner, Dakshina Kannada District. I request Dr. Imad Mohammad Ismail, Joint Organizing Secretary of the conference and Associate Professor in the Department of Community Medicine, to introduce our guest of honor.
Yeah, good morning all. It is my privilege to introduce our beloved DC, Dr. Rajendra KV sir. Sir has completed his graduation in MBBS and later he is an IAS officer of 2013 batch. Sir hails from Shimoga district. The post that sir has held previously is as an IAS probationer officer in Bidar district from 2013 to 15, Subdivision Magistrate, Puttur, 2015 to 16, Chief Executive Officer, Zilla Panchayat, Ballari, 2016 to 19, Chief Executive Officer, Zilla Panchayat, Belagavi, 2019 to 20, and Deputy Commissioner, DK District, July 2020 till date. Sir has a keen interest in healthcare sector. In the past 2 years, especially during the COVID time and post-COVID time, under Sir's leadership, the DK District was able to handle the COVID outbreak. Thank you, sir. The health system as well as the public-private partnership of DK District is supposed to be one of the best in India, and thanks to the leadership that we have under Sir. Now, I invite our DC to address the gathering.
Very warm good morning to all of you. Dignitaries on the dais, delegates coming from the different corner of the state and outside the state. Hearty welcome to Mangalore. I have become quite a frequent visitor to Yenepoya Medical College. I think last 2-3 months, this is my third or fourth function I am attending. Every time they come and invite me, I'll just go through their invitation and what are the topics I would be giving speeches on and what are the things I would be getting to know. In this invitation, though, I wanted to tell no, but many of the keywords, what I read on the invitation, it amazed me. And not as a dignitary on the dais, I wanted to be an audience. That is what I expressed to Dr. Abhay Nirgude also. Because community medicine and sustainable development goals and the roadmap, the discussion, this part is quite in aligned with the things what we are doing in a day-to-day affairs as an administrator in the districts. First of all, I would like to convey my heartfelt gratitude all those community health experts, public experts, community medicine experts for actively involving themselves in the management of COVID. In case if DK district is considered as one of the best district to handle the COVID related things, I would like to dedicate that to all the experts, community health experts, those who are there in the panel to assist the district administration. Heartfelt gratitude and thank you and congratulations to all of you to tackle over that, whatever the tide, it had like fast approaching us. Community medicine, though we all talk about the preventive aspects of it, I have learned community medicine in a different phases. As an undergraduate, that was the most boring topic for me. And I was in JJ Medical College, I was the person who scored lowest marks in the community medicine. And I was so scared that I would fail in the community medicine. I did everything, but eventually, like, I think I was the second worst or the lowest person in the sense like my marks were lowest in the entire batch. But later on, my intention was to prepare for the civil service administration, civil service and the competitive exams. Every time I was going through competitive examination, how community medicine is such an important aspect of the medicine. It opened my eyes. Maybe I think once I started practicing in a primary health center or as a junior doctor in a neuromedicine department, and later on when I was preparing for the competitive exams, later on slowly I started realizing the importance of the community medicine. Maybe most commonly asked question for any doctor, those who have joined civil services, is why as a doctor you chose civil services. Social determinants of the health, this is a commonly uttered explanation from every single doctor who has joined the civil services. Health should not be seen, doctor should not be seen as a person who gives only treatment to the diseases. The person who helps in controlling the disease, the person who helps to understand the history of the disease, the person who helps to prevent the disease, that person is also very, very important. See, if at all, if we draw a parallel between a relay competition and a practice of medicine, first 3 labs are being run by the community health experts. Only last lab, which is the most glamorous thing, is attended by the practitioners of clinical medicines. Maybe during the last phase also community health experts, they will be running parallelly, but their contribution is not very well recognized in the public domain. But I'm 100% sure as a public administrator, I always know the importance of public health experts. I think you can always get the feedback from the present HOD madam and previous HOD Abhay Nirgude also. Every time we were making a decision, we were making sure that, okay, whatever the decision during COVID, that has to be a scientific one, that has to be a rational one, that has to be having some sort of evidence-based backup for our decisions. We were making sure, while before taking any of the restrictive measures or some sort of prospective measures, we were always consulting the public health experts. That's why maybe if at all, if I'm spending my crucial hours of administration today here, just to express the gratitude towards the public health experts. And next important thing is the sustainable development goals. These are all topics which we prepared really hard for our general studies examination in the civil service preparations. But though we talk about so many sustainable development goals, we keep on pushing the goals, the target period, timeline, what we are like pushing. Maybe I think maybe some of the topics which we usually used to fail the undergraduates, the way sustainable development goals, that concept of developmental goals, sustainable millennial goals. If I remember correctly, I think it all started with the millennial goals or some sort of Rio de Janeiro, some conference somewhere. I think they will be asking these type of topics and eventually they will fail the undergraduate students. Maybe millennium goals, later on we pushed it to 2015, 2020. I think now the target is to 2030, I think. 17 sustainable development goals. And of all the developmental goals, maybe reducing the hunger, reducing the poverty, bringing the gender equality, energy efficiency, all those things. I always believe in the 17th goal, partnership for the goals. See, because every goal, it takes multi-stakeholder approach, multi-pronged approach. It needs a different type of treatment for every single goal. That health indicators, I can't simply call on health people to discuss about the health related issues because it needs some sort of education. It needs some efforts to reduce the poverty also. It needs some sort of like energy consumption and efficient energy usage also. Effective usage of the IT field also. And meanwhile, the development should not be in conflict with the wildlife and the nature and the ocean also. All these things, what that goal amazed me is like partnership for the goal. That is the 17th goal. That is a very, very important thing. Maybe as an administrator, as a public health experts, we all should emphasize on that part more. We should deliberate more upon it. And oceans are made of all single drops. We should not think that, okay, some other country should achieve. I think more than 190 countries will be participating in these type of things. You would have seen UN General Assembly, and there is like separate forum for economic and socio-economic affairs in the UN also. They will be working upon it. We will be reading in all glamorous, some sort of like flamboyant newspapers, English newspapers, discussing about the Millennium Development Goals, Sustainable Development Goals. But this should be even talked in the Gram Panchayat level also. Every person should be knowing about these type of things. Every administrator, even in the village level, primary health center level, we should be focusing on achieving the sustainable development goals rather than focusing on the major sustainable development goals in a planetary wise. Rather than attending that thing, it should be split into different pieces and you should try to like achieve in a smaller goals in a Gram Panchayat level also. Maybe public health experts, the amount of knowledge what you are gathered, that should reach out to the masses. See, every effort of public health expert in the roadmap to achieve the sustainable development goal, it should bring peace and prosperity to the population and the planet. Maybe next 2 days, I went through topic for the discussion. Actually, anyhow, though I was ready, I was just waiting for 10 o'clock so that I can reach here by 10:30. If had I got this topics list earlier, I would have come here at 9 o'clock because tuberculosis elimination strategies, challenges and roadmap. As I mentioned in the beginning itself, I wanted to attend this program not as a dignitary on the dais. I wanted to be an audience so that I wanted to hear from the public health experts so that I can use some knowledge to change the scenario in our districts also. I was just throwing questions in some of the meetings to our public health experts also. There are different phenomena we have witnessed. Changes in the way we are looking at the disease during the COVID and post-COVID. And Dakshin Kannada district being one of the major endemic area where 90% of the Karnataka's malaria, dengue, chikungunya cases are being reported from. Maybe because of the coastal marshy area we are getting it. Maybe 90% of the Dakshin Kannada cases are coming from Mangalore and surrounding places. Surprisingly, during COVID, though our sample collection has not reduced, and some of the public health experts also expressed a view, maybe there are lesser cases reporting, lesser number of registration, but still during COVID pandemic, drastically malaria cases have come down. I'm trying to find an answer for it, but I have failed utterly. Maybe I think some of the experts also, they can deliberate upon these type of issues. They can really help the administrator to take the proper decision. I wish you all the very best for all the delegates, those who have come from different corners of the state, to make use of this deliberation, very worthy for their careers. And I congratulate the administration of the Yenepoya Medical College for their leadership in organizing the many events related to the issues which are very specific to the Dakshin Kannada district. I would like to congratulate all the organizing committee once again from the district administration. Thank you one and all for giving me this opportunity to come here and be among with us. Thank you. Thank you one and all.
Thank you, sir, for your inspiring words. I request Dr. Shripati Rao, Honorable Pro Vice Chancellor, Yenepoya deemed to be University, to felicitate our guest of honor, Dr. Rajendra KV. Thank you, sir. Now I request Dr. Harivansh Chopra, President, National IAPSM, to address the gathering.
Thank you. Bye-bye. नमस्कार, गुड मॉर्निंग। आपके मतलब की बात कहता हूं, जुबा मेरी है, बात आपकी। आपके मतलब की बात कहता हूं, जुबा मेरी है, बात आपकी। आपकी सेकंड स्टेट कॉन्फ्रेंस संवारता हूं, सितारे मेरे हैं, दिन आपके। Dignitaries on the dais, off the dais, and my dear participants who have registered for this second state IAPSM conference. I am extremely delighted to be here with you as a part of the larger fraternity of IAPSM, and at the very outset, I would like to thank you from the bottom of my heart for supporting me throughout this 1.5 years. And the journey has been a very, very exciting and rewarding. And as Dr. Poonam was telling you, when they decided to host this conference, we had number of interactions, some sweet, some sour also, but the enthusiasm of the organizing chairperson is such that she kept on forcing me to travel more than 2,000 kilometers to attend this particular conference. and her dedication and constant effort reminds me of two lines which I would like to dedicate to her. Madam, this is for you. गर तुम देखना चाहते हो मेरी उड़ान को, गर तुम देखना चाहते हो मेरी उड़ान को, तो जाओ जाकर और ऊंचा करो आसमान को. So that is the courage, the dedication which is there with Dr. Poonam and the whole team who has worked very, very hard to reach to this glamorous stage of organizing this particular conference, keeping in mind the crucial components. There are a number of C's which I always talk must have in every community medicine professional. And let me start from those C's first for 2 minutes. I will not take much time. As asked by Dr. Kulkarni, I have to finish in 5 minutes. So I always say a community medicine person, a real community medicine person is the one who studies a lot. Because my professor used to tell me that you must know much better than MD medicine, than MD pediatrics, and MD gynae. And you have to work in the field. So your concept regarding health and disease must be absolutely clear, and this clarity will come only when you work in the field. And once this clarity comes, then you develop your conviction, and once you develop the conviction, then you will have the courage. And why I'm saying so, to have the courage, because when we talk of these goals, we started with health for all, then Millennium Development Goal, and now we are talking of Sustainable Development Goal. And in heart of heart, all of us knows as community medicine professionals, as public health professionals, that this is just to give impetus to control the problems which are facing the world. The goalpost is going to shift sooner or later. And why I say the courage is important, the courage is important to accept or to deny the wrong things which are being propagated, maybe by the politics or the politicians, or maybe by the administrators. But as an academic body, it is our responsibility to accept the changes as well as to criticize those changes if they are not going to fulfill the objective, because we are living in a country which is a resource-starved country, and resources are to be utilized in an optimal fashion. Once you develop the courage, then you have to start coordinating. And you cannot work in silos now. Public health is not only the domain of community medicine professional. You have to coordinate with the district health system, with the administration, with the politicians. So whatsoever you have learned, if you can think that how it can be implemented so that we can make this world a better place for living. So that is again important. And last but not the least, another C is the art of communication. How do you communicate? You don't have to criticize anybody. You don't have to offend anybody. You have to be very, very mild in approach, but be concise. So this is what I wanted to talk about. And I will request all of you, this is the second state conference. We are going to have the Golden Jubilee Conference of IAPSM in Hyderabad from 2nd to 4th February. And we are making our organization member-centric, and there are going to be many changes which have been approved by the Governing Council, and we need the support of the general body. So my request is to you that kindly come there, raise your voices, and make the organization stronger and stronger by your active participation. And before I leave, seeing this beautiful hall, these beautiful flowers, and the beautiful people of Yenepoya Medical College and Mangalore, I'll finish my talk by 4 lines. लहर आती है, किनारे से टकरा के चली जाती है. लहर आती है, किनारे से टकरा के चली जाती है. याद तुम सब की अनजाने से दिल में समा जाती है. और लहर और याद में फ़र्क है तो सिर्फ इतना. लहर और याद में फ़र्क है तो सिर्फ इतना कि लहर बेवक्त आती है और आपकी याद हर वक्त आती है. थैंक यू वेरी मच.
Thank you, sir. I request Dr. Purushottam Giri, Secretary General, National IAPSM, to address the gathering.
Respected dignitaries on the dais, off the dais, senior teachers, my colleagues and dear delegates. First of all, being a National Secretary, I take this opportunity to welcome all of you in this grand second state, Karnataka State IAPSM Conference 2022 at Mangalore, Yenepoya University, Mangalore. It is noteworthy that the theme was chosen for this conference is Roadmap to Sustainable Development Goals with many sub-themes, which is various of the public health importance. All of you are aware that the current fragmented framework of health governance for the humans, even animals and environment, together with unconventional linear approach for solving the current health problems, is failing to meet today's health challenges and is proving unsustainable. So, the roadmap can be used in this communication with other stakeholders to involve or to implementing the SDG, like policymakers, academia, civil society, private sector, media, to explain the issue related to the statistics of sustainable development goals and even critical role of official statistics. I am very confident that the conference is meticulously planned with an enriching scientific papers. Plenary sessions are being delivered by the renowned speakers from institutes like UNICEF, UNDP, PHFI, Bill and Melinda Gates Foundation, Tata Trust, and Government of Karnataka, to name a few. I am sure that the deliberation in this conference will ignite the minds of community medicine specialists, public health experts, medical students, and academicians to chart out the intricacies involved in this theme. I wholeheartedly appreciate and congratulate the efforts of the Department of Community Medicine of Yenepoya Medical College, deemed to be University, Mangalore, especially Dr. Poonam Naik, ma'am, and Dr. Abhay Nirgude, and their whole team to organize such a grand conference. This second state conference of IAPSM is one of the effective reflection of its scientific, academic, and social contribution. Not only does it allow us to meet, greet, and eat, but also provides a unique forum for exchange of knowledge, share ideas and thoughts, and opportunities to serve the community in much better way. I sincerely appreciate the keen interest of the all registered delegates. Because of their keen interest for the constant updation that such academic event become successful. I am sure that the deliberation in the conference will succeed the walk on this path and improving various soft skills of the faculties and students in the field of community medicine and public health. At the end of this 2 days conference, this grand academic feast will prove to be a great event for all of you. I wish all the delegates an enjoyable learning experience in the conference. Last but not the least, I extend my best wishes for the grand success of the conference. Jai Hind, Jai Bharat, long live IAPSM. Thank you.
Thank you, sir, for your kind words. I now request Dr. A.J. Kulkarni, President, IAPSM Karnataka State Chapter, to address the gathering.
नाहं कर्ता हरिः कर्ता तत्पूजा कर्म चाकिलं तथापि मत्कृता पूजा तत्प्रसादेन नान्यथा. Dignitaries on the dais, off the dais, ladies and gentlemen, I have requested all my friends to speak less, so I will also stick to that principle. I will talk only about two things: IAPSM Karnataka State Chapter and IAPP, that is Intercollegiate Academic Program for Postgraduates. Most of you must be wondering, where was this Karnataka State Chapter? Okay, what were they doing for all these years? This is only second conference. So I'll just talk to you a little bit about that. The IAPSM Karnataka State Chapter was born in June 2016, and that time it's the main hard work of Dr. Hemagiri and many of us, but main work is Dr. Hemagiri. I have to put it on record. Because of that, the Karnataka State Chapter came into existence. After 1 year, in June 2017, we changed the entire team, and first president was Dr. Ashok NC from JSS Medical College, and I became the second president. Vinay became the second secretary, and the team was also changed. In December 2017, we conducted the first state conference at JSS Medical College, Mysore. The conference was really very well organized by the entire team. We put a lot of efforts also, but still I was not happy with the outcome. I thought, because we were infant that time, we had just born. Okay? You cannot expect the performance of an infant like an adult. Everybody was comparing our conference to Catch Conference, which is well established and entrenched in Karnataka. So we thought we will wait for a little while, organize ourselves better, and do a better conference. We waited for some time, but unfortunately this COVID came and we were not able to conduct the conference. As they say, sabar ka phal meetha hota hai. So I think the wait was worthwhile, looking at the way this second conference has been organized by Dr. Poonam and his entire team. Just one word for me. Okay? She says, sir, whatever you say, I will do. She is one of the very good students that I have been having, and she just respected my word, and I feel that, Dr. Poonam, you have given me a very good Guru Dakshina in the form of organizing this conference. Now I will talk about IAPP, jointly organized by Intercollegiate Academic Program for Postgraduates. Many people are not aware of this. What is this? I was working in Mumbai, and in my introduction, I think they have mentioned when I was a chairperson, and I was very happy working there. One fine day, one doctor, Mr. Ramakrishna from KVG Medical College, came to my house and says, we want you to come to Sulya to establish our community medicine department and start post-graduation there. ಎಲ್ಲರೂ ಹಳ್ಳಿಯಿಂದ ದಿಲ್ಲಿಗೆ ಹೋಗ್ತಾರೆ, ನಾನು ಮುಂಬೈಯಿಂದ ಹಳ್ಳಿಗೆ ಬಂದೆ. So we started, I came in 2007, and 2008 we started the first MD community medicine in entire Bangalore except Manipal. Manipal was already having MD community medicine, but in Bangalore I started in 2008. In 2011, the first product came out. Again, like my first conference, I was not happy with my own product. Not that we did not have good teachers, not that the students were not good, but as all of you are aware, in all medical colleges, government or private, there are some shortcomings. So a thought came to my mind, what should we do to increase the quality of our product? So by that time, Yenepoya Medical College, AJ Medical College, and Kshema had also started MD community medicine. So I talked to all these HODs, and we decided that we should meet once in a month in each college so that deficiencies of one medical college is covered by the others. So this is how in 2012 intercollegiate academic program for postgraduates was born, and I am glad to inform that the first session of IAPP was also held in Yenepoya Medical College only. Dr. Radha Aras was the head of the department there that time, and she was my classmate, and it went on very well for several years, and after several years all the HODs of all the 3 medical colleges changed, and the concept of IAPP was not very clear to them, and somehow it also again went into dormant stage. So now I want to promise you that we have decided to revitalize IAPP, and we will be conducting regular sessions for postgraduates and junior faculty. So I request all of you to become members of IAPP and IAPSM. There are counters, okay, there is one counter I believe. Okay, all of you please become members if you are not a member, and take the benefit of whatever we are trying to achieve. So I want to end by saying one shloka from Bhagavad Gita, 4th chapter, 38th shloka. Nahi jnanena sadrisham pavitra miha vidyate. We are organizing. That means there is nothing, either a substance or activity, which is more pious, pavitra than jnana. So we are conducting this jnana yajna, and I believe all of you will take participation in this jnana yajna and take full benefit of this conference. Thank you very much.
Thank you, sir, for your wonderful words. I now request Dr. Madhavi Bhargava, Associate Professor, Department of Community Medicine, and Deputy Head, Center for Nutritional Studies, Yenepoya deemed to be University, to introduce our chief guest to the audience.
Thank you, Dr. Mubina. Good morning, one and all. It's my great privilege to introduce Dr. Nupur Roy, public health specialist with more than 31 years of experience. She's currently serving as a senior national program manager since 2013, heading Kala Azar, lymphatic filariasis, Japanese encephalitis, IEC BCC activities, and capacity building at National Center for Vector-Borne Disease Control, New Delhi. A medical graduate from Medical College, Kolkata, and having specialized at ophthalmology from University College of Medicine, Kolkata, she also got trained at public health from All India Institute of Hygiene and Public Health, Kolkata, and in management of dermatological entities from Barcelona, Spain. She has extensive experience in disease control programs with special focus on Kala Azar and lymphatic filariasis. She contributed in initiation of triple drug therapy for lymphatic filariasis, various operational guidelines on Kala Azar, multiple government guidelines, and strategies in the field of neglected tropical disease. She has contributed to many international and national publications in lymphatic filariasis and Kala Azar. She is member of SPEAK Consortium for Visceral Leishmaniasis, London School of Hygiene and Tropical Medicine, WHO Development Group, and National Essential Drug List Drug Committee. She is a member of Indian Society of Malaria and other communicable diseases. I invite you, ma'am, to address the gathering.
Good morning, all. First of all, I would like to express my gratitude to the organizers of this second state conference of IAPSM, Karnataka chapter, being convened in the beautiful campus of Medical College today and tomorrow with the theme Roadmap to Sustainable Development Goals. And I'll start. A big thanks to the dignitaries on the dais, and officers, partners agencies, and state government of Karnataka, friends, ladies and gentlemen, all present in this auditorium. So it gives me a lot of pleasure to be here amongst the luminaries who have played a vital role, not only in the comprehensively understanding the importance of NTDs, the talk of the day now, but have walked many miles in immensely contributing towards prevention and control of NTDs in the country. Besides, both central government and state governments are doing a wonderful job and providing desired impetus in hurtling towards the pragmatic goals of not only prevention and control, but towards elimination of 3 eliminable disease which are all vector-borne disease: malaria, fileria, and Kala-Azar, which are 3. Not malaria is not under the list of NTDs, but these 2 diseases, VL and LF, are among 20 enlisted NTDs of WHO. So well, if I start with VL elimination, you know it is my passion. I am working in the NVB-DCP. Now we have changed the name, that National Center for Disease Control, since last decade. So we worked along with in public health. My mentor, Dr. Dhariyal, told me that in public health, you never say me, it's a we, us. So there is no personal contribution can make any change in the community medicine. So whatever has been achieved is the contribution of each and everyone, starting from the peripheral worker, ASHA, and to the highest, the health minister, PMO, all. Everybody contributed a lot to this, and I am very happy to announce that, you know, Kala-Azar is only prevalent in 4 states, that is Bihar, UP, Jharkhand, and West Bengal. And 54 districts are endemic, and among these 54 endemic districts, there are 633 block. Why I am calling block? Because the elimination definition is there should be less than 1 case per 10,000 population at block level. So there is a great achievement that by the end of 2021, only 8 blocks remain to achieve elimination. 2 of them were from Bihar, 6 were there from Jharkhand. So West Bengal and UP has sustained the elimination since last 3 years. So it is a great achievement indeed for all of us. And now there is an urgent need to sustain these gains, for which both state, central government need to develop a realistic roadmap in consultation with the stakeholders. And the roadmap thus developed needs to be implemented in letter and spirit in the field, which shall then enable us to invite WHO for starting the process of validation, which in other words means more responsibility, alertness, and honest dedication in achieving the desired milestones. So we are talking about the SDG goals. There are 17. First one is there is no poverty, and last one is partnership. So our Deputy Commissioner also said, and all the dignitaries who have spoken before me, they also indicated this. So partnership is very, very important, because when Kala-Azar it was possible, we were having partners, but as we see that lymphatic filariasis, it's a different perspective from its epidemiological occurrence also. This platform provides me an opportunity in discussion with all of you, the specific roles of medical colleges. So medical colleges earlier, they are already contributing to the programs. For example, like this post-MD assessment is done by the medical colleges. For VL, we have already identified some medical colleges adjacent to the endemic states, so that day by day, when there will be a number of cases reducing, there will be center of excellence which will provide the need of the patients from outreach areas. Well, as you know, LF is endemic in 328 districts across 20 state UTs in the country, but our strengthened resolve, we have achieved less than 1 MF rate in 134 districts that have stopped MDA, the preliminary goal of elimination. And we always talk about the southern states, they are the good performing states. And since this conference is happening here, I would like to say that Uttar Kannada, Dakshin Kannada and Udupi, these 3 districts were first out of these 328 districts who cleared transmission assessment 3. That means they have eliminated the disease from these districts. And state-wise, out of these 20 state UTs, 5 states have already eliminated and are under post-MDA surveillance. We are also working, including the, for LF, all of you know the community medicine, all of us here know that it started with the campaign of mass drug administration from 2004, subsequent to the World Health Assembly 1997, 5029. Two-pronged strategy was adopted. One is mass drug administration for interruption of transmission, and the second one is MMDP, to take care of the patients who have already afflicted with the disease. So now, in Karnataka, there are 30 districts, as per my information available data. 8 districts are endemic. Among these, 3 have cleared. Another 2 are under different stages of transmission assessment survey. And 3 hardcore districts are there. Those are Bidar, Yadgir and Gulbarga. They are very hardcore area for MF, and we are struggling. We have to reduce, to expedite the elimination. We have introduced as that we have launched triple drug therapy, that is from since 2018, to reduce the number of MDA rounds from 5 to 6 to 2 to 3 rounds. So very soon they will be observing their 3rd round or 4th round of IDA in these 3 districts. And we are also working to include DEC medicated salt, I should rather say DEC fortified salt, as an adjunct to MDA. And this exercise is being explored with help of experts from different areas of specialization. For bringing succor to the diseased people, medical colleges can play a vital role if they take upon themselves in alleviating the suffering of the patient by opening up to them through MMDP clinics and through building capacities of the concerned state level official for making it a mass campaign, which will enable the people in endemic areas to individually take it up at their homes with the support of all those dedicated towards goal of elimination. The assessment of MDA activity, especially the drug consumption, still remains a challenge, because all of us know that if we have good round of effective MDA, 5 or 6 years is enough, but it could not happen, and it is still remaining a challenge, because despite the effort put in by all agencies, there is still a gap between drug administration and consumption. Earlier we used to say distribution, nowadays we have deleted that word distribution. Through the role of assessment has been already resting with the chosen medical colleges. And here I would like to request the medical colleges to come into action to give us, to raise the compliance for mass drug administration. Hydrocele is one of the very common symptom among LF patient, and timely conduction of surgery is essential in mitigating the sufferings of large number of patients. In India, almost 5 lakhs hydrocele are accumulated. We need to clear those backlog. And diagnosis of LF is nobody take it very seriously, but it is very complicated. The entire year there are some or other intervention is going, either MDA or night blood survey or transmission assessment survey. So diagnosis of LF is very, very difficult because you know the time of the microfilaria appearing in the peripheral blood circulation is after 8 p.m. So it becomes difficult to do this, and we merely have any diagnostic which can reduce this problem. So we need to develop a quick and reliable method of diagnosis for LF patients which can help us overcome the complexities of this night blood survey. I am hopeful that these 2 days deliberations by the experts shall bring about pragmatic solutions for use by the program personnel, both the state and at national level. And now I am only spoken about the vector-borne diseases. There are other diseases also. So like Deputy Commissioner spoke about tuberculosis, those are also public health problem. So I hope there are young energetic horses are sitting here, so they will take forward all the programs in future so that we can get a healthy and disease-free India. I wish the conference a great success, and I would like to again thank the dignitaries and the organizers of this conference and the staffs of this Yenepoya Medical College. Thank you so much. Thank you.
Thank you for your kind words, ma'am. I now request Dr. Abhay S. Nirgude, Organizing Co-Chairperson of the Conference and Associate Dean, Yenepoya Medical College, to introduce Dr. Shripati Rao, Honorable Pro Vice Chancellor, Yenepoya deemed to be University.
So, sir doesn't require any introduction for us, just for the benefit of our IAPSM delegates. Sir is a renowned maxillofacial surgeon from basically hailing from the coastal town Mulki. Done his BDS and MDS from KMC Manipal. He is a fellow of Faculty of Dental Sciences, Royal College of Physicians and Surgeons, Glasgow, Scotland. He has undergone surgical training in implantology. He has a rich experience of 42 years as a teacher, researcher, academician, and a gate administrator. Sir was a former executive committee member of Dental Council of India. He was the dean for Yenepoya Dental College for longest year, I think 30 years. He is a member of ICMR review committee in the field of oral health, New Delhi. He has been member and the advisor for more than 8 universities, not only all over India. So it's great privilege to introduce sir. Over to you, sir, for the presidential address. Thank you.
Good morning. I know it's a very, very odd time to listen to the tail ender. It's always in a cricket. The presidential speech is something like a tail ender in a cricket. If the openers have played very well, there is nothing left for the president to, or the tail ender to do. That's what has happened. So my dear colleagues, I will not touch upon your subject because I am not an expert in this field. However, dignitaries on the dais, the dear delegates who have come from all over Karnataka, and all the guest faculty who are gathered here to enrich the knowledge of the delegates or the aspirants of this conference. I have associated with this institution for the last 30 years. I have seen the way the institution has grown. and I've seen how the departments have developed. I would like to congratulate Dr. Poonam Madam for taking all efforts in organizing this conference. I always say they are like a double engine. Husband is the vice principal and wife is the head of the department, and always our government says that the double engine always works better, and that's what has happened, resulted in a beautiful conference. I am sure all of you will enjoy the scientific bonanza and the hospitality of our university. Let me promise one thing from the university, that we are always here to support any academic programs. Whoever comes forward and gives us an opportunity to conduct, we are ready to accept it. This is one assurance from our university, always there for any scientific activity. Even in future also, if you want to conduct the national program, you can catch her. Maybe after a few years, we can have the national community health program here, because Mangalore is the right place to have the community programs. As the DC mentioned, that during the COVID time, we really did excellent job, because in this place, we have got 8 medical colleges. You can imagine the support what we get out of the faculty from all these medical colleges. And Dr. Abhay was in the forefront of our institution. I'll tell you, it was a beautiful management of the COVID. Starting from diagnosis till they are sent home, it was beautifully managed by this. So when I say that, I always say that we have a very vibrant community health department here. Besides doing the routine work, the department has certain other distinctions. 3 times they have got the awards for the innovations and the research to the Department of Community Health. That is creditable. And it's a common thing that now everybody adapts the villages. But for the last 10 years, we are first one to adapt the family adaptation program. It has happened in Yenepoya, and today NMC has made it mandatory for all the colleges. So we were there for the last 10 years. It was introduced in our institution. And during, as I said, during the COVID time, this team has worked so hard that there was a lot of appreciation from the district commissioner, actually. Yeah. Hello. It's only for the light. It's okay. Hello. Mic connect. Yeah, that's fine. That's fine. So there is a lot to say about the department, but you'll know in the next 2 days when they participate in all these programs. As a Pro-Vice Chancellor of the university, definitely I would like to highlight some of the things what you have in the university, which I want all of you to go around and see. That's the reason I'm talking about it. We have a very vibrant Vice Chancellor. Unfortunately, today he's not there, but tomorrow he'll be witnessing. And because of his dynamism, we have started a massive cancer drive here. Today, we have the, we have almost trained about 29,000 NSS volunteers, officers, ASHA workers, Anganwadis, and teachers from various colleges, and they go around and educate the public regarding the cancer. So that sort of challenge has been taken by a university, and the result of that, the Tata came forward to offer us a hospital in our campus. It's because of the good work what is done by our team under the leadership of our Vice Chancellor that today we have a Zuleika Cancer Institute in our campus. It's worth seeing it because one of the finest institutions we have. Now, in addition to that, we have certain unique things actually. If your time permits, it should go. We have got what is called the central training center for the students. That is the simulation center. I can proudly say that one of the finest simulation center here where students can have virtual training. The clinical students can go and learn about each procedure through this. We also have an advanced surgical training section here where you are taught or you will experience how to do the minimal invasion surgeries, the robotic surgeries. All these things are taught in large animals and in the frozen dead animals or the human bodies. So these are the facilities we have, and also I am very proud to say that we have got one of the finest research center doing all sort of research, including proteomics, genomics, stem cells, whatnot. you have to witness, you have to go around and see, then only you will believe that we have. In addition to that, we also have what is called incubation center, where it is open for everybody to come and do their startups. Our universities facilities are not only for our students. Our chancellor always says that these facilities for all those who want to come and learn and participate with us. So it's an open invitation to all of you. If you want to collaborate with our university, any of the facilities, you are most welcome. Only thing is, you just contact our university, our registrar, and then you can definitely involve with this. You can do any sort of activities in our institution. My dear friends, I don't want to speak anymore because you're all eagerly waiting to listen to these speakers. The pandemic has really taught us a lesson in Bangalore. Till then, nobody was bothered to streamline the management. Today, we are all geared up. I hope in future, even if I have any calamities, I'm sure not only Bangalore, our whole country is geared up to face it. But we can't ignore it because we don't know when the new infectious disease will start or there is a re-emergence of the existing disease. So my dear colleagues, we'll have to sit, debate, innovate, do research, and put a proper roadmap for the future challenges. Thank you one and all. God bless all of you.
Thank you, sir, for your inspiring words. I now request Dr. Gangadhar Soumya ji, Registrar, Yenepoya deemed to be University, to felicitate our chief guest, Dr. Nupur Roy.
I now request Dr. Abhay S. Nirgude, Organizing Co-Chairperson, Associate Dean, Yenepoya Medical College, to felicitate our Presiding Officer, Dr. Shripati Rao. Thank you, sir. I now invite Dr. Poonam R. Naik, Organizing Chairperson of this conference, to felicitate Dr. Harivansh Chopra, President, National IAPSM. Thank you, ma'am. I request Dr. Poonam ma'am to felicitate Dr. Purushottam Giri, Secretary, National IAPSM.
I now invite Dr. Akshay KM, Organizing Secretary of the conference, to felicitate Dr. A.J. Kulkarni, President, IPSM, Karnataka State Chapter. I request Dr. Akshay KM to felicitate Dr. Vinay M, Secretary, IPSM, Karnataka State Chapter. Thank you, sir. I now invite Dr. Poonam R. Naik to felicitate Dr. Gangadhar Soumya ji, Registrar, Yenepoya deemed to be University. I request Poonam ma'am to felicitate Dr. M.S. Musaba, Dean, Yenepoya Medical College.
Thank you, ma'am. I now invite Dr. Akshay KM to felicitate Dr. Hemgiri K, Professor and Head, Department of Community Medicine, Karwar Institute of Medical Sciences, and our KMC observer for the conference. I request Dr. Akshay sir to felicitate Dr. Ashwini Dutt, Associate Dean, Yenepoya Medical College. Thank you, sir. Now I invite Dr. Akshay KM, Organizing Secretary of the Conference and Additional Professor, Department of Community Medicine, Yenepoya Medical College, to deliver the vote of thanks. Over to you, sir.
Good afternoon. It's 12, so I need to be short. Respected dignitaries on the dais and off the dais, Namaskara, good afternoon. No duty is more urgent than that of returning thanks. So it's a privilege to propose the vote of thanks on this inaugural program of Second State Conference of IAPSM, organized in collaboration with IAPP. On behalf of the organizing committee, we place on record the gratitude to Dr. Yenepoya Abdullah Kuni, our Chancellor, Mr. Farad Yenepoya, Pro-Chancellor, and Dr. M. Vijay Kumar, our Vice Chancellor, who could not attend today's programs due to their other commitments. They have been always highly supportive in our department initiatives, including this particular conference. On behalf of the organizing committee, we thank Dr. Shripati Rao sir, Pro-Vice Chancellor, for having delivered the presidential address. He has been a constant source of support, encouragement to all our department endeavors. We are highly indebted to Dr. Nupur Roy, ma'am, chief guest for today's program, for your wholehearted support towards this conference and accepting our invitation. Thank you, ma'am. We thank our guest of honor in absentia now, Dr. Rajendra KV, IAS, Deputy Commissioner, Dakshin Kannada District, for taking out time from his busy schedule to address us. Registrar, Yenepoya deemed to be University, Dr. Gangadhar Somyaji sir, and our beloved Dean, Dr. Musaba sir, have guided us and supported us in every stage during the organization of this conference. We thank you wholeheartedly. We thank the national and state IAPSM office bearers for giving us this opportunity to host the conference. A special thanks to Dr. Harivansh Chopra for helping us to network with various organizations. We thank Dr. Hemgiri, Professor and Head, Community Medicine, Karwar Institute of Medical Sciences, who is amidst us as a KMC observer. The scientific sessions of this conference B, PATH, Institute of Public Health, Tata Memorial Hospital, NIMANS, SIFSW, representatives from Government of Karnataka and Government of Andhra Pradesh, and organizations from government as well as non-governmental sectors, and also academicians from Karnataka and Kerala. We thank all their organizations and their representatives. I thank all the deans, associate deans, center heads, university officials, heads and faculty of departments who are present and who are present during this inaugural program. Thank you, Poonam ma'am and Abhay sir, for giving me an opportunity to take up this particular role. I acknowledge the contribution of all my department colleagues, postgraduate residents, support staff, who have put up a great show in organizing this particular conference. Thank you all to our distinguished resource persons and the delegates for responding to our call and attending this particular conference in large numbers. Faculty from other departments and our student volunteers have extended their support towards the smooth conduct of this particular conference. I thank each one of you. We extend our thanks to the friends from the media for covering this event. We would like to thank the PRO, Yenepoya deemed to be University, Mr. Asim and his team from Yenepoya Technology Incubator, our logistics partners, hospitality partners, Foodcraft, our event managers, A1 Logics, Mr. Satish Shashi Nair, and the maintenance team who have helped in logistics and venue arrangements. After all this, if I have not acknowledged someone, it's not out of purpose. I may be excused, please. Thank you, one and all. Jai Hind and Jai Karnataka.
Thank you, sir. With this, we come to the end of inaugural of the conference, and I request everyone to rise for the national anthem. जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल वंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभाशिष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे. We shall now break for some refreshments. The scientific sessions will continue from 12:20 p.m. onwards. Thank you.
Any 6 we will keep.
Recording stopped.
We'll have to just